I'd just like to make a comment about my own clinical experience with using BergaMet. I probably have the largest single clinical experience in the world, having used it now for 4 years in I would say, around 3,500 patients. And I feel very strongly that, firstly, we should be using BergaMet. We call it BergaMet in Australia. It's marketed as a thing called BergaMet Mega. And it's my strong opinion that everyone over the age of 50 should be taking this to maintain a healthy vascular system. But I've also seen in people with clinical ischemic heart disease numerous cases of reversal. I haven't published this in a paper. I run a very large private practice in Sydney, Australia, but I've seen a number of people in whom I've done stress echocardiography demonstrating ischemia after 1 to 2 years taking BergaMet. That ischemia is gone. I've seen people where we do the arterial stiffness measurements have a 50% reduction after 6 months of being on BergaMet in their arterial stiffness. So, to me, the question is, why wouldn't you, if you've hit the age of 50, take BergaMet as a form of vascular protection? I believe all people on statin therapy should also be on BergaMet because it allows you to use, as we so elegantly describe in the paper, allows you to use half the dose of the statin and get a better response on the overall lipid profile, including a much better response, shifting your lipoprotein profile from the small LDL, small HDL to large LDL and large HDL. So I think the combination of a statin and BergaMet is superb combination. So everybody who takes a statin should also be on BergaMet, allowing you to use a lower dose. Every person with metabolic syndrome should be taking a statin as well. Now, just to use US figures, there are 75 million people in the US with metabolic syndrome alone. In my country, there are 16 million prescriptions written for statin drugs every year alone. And we're just not using BergaMet to its capacity. So, and I just don't understand why. I don't know. The science is there. The science has been beautifully done and brilliantly organised by my friend Professor Malachi. So to me, BergaMet needs to be promoted by everybody because it's, I think, in my clinical experience now of 30 years, it is the best natural product I have ever seen.